Hi there folks, Michael from First Aid Oz once again. We're going to talk about heart attack or suspected heart attack, and heart attack as opposed to cardiac arrest or sudden cardiac arrest. Two distinctly different things. So with heart attack, the most common cause of heart attack is basically lifestyle factors. Okay, so heart attack is blockage in the coronary artery, which is normally the cause of heart attack, or sometimes can be more than one artery, and it's often caused by a buildup of plaque on the inside arterial wall, which could be due to high cholesterol, which effectively narrows the arteries, if you like, which increases the blood pressure or the strain on the heart trying to get blood through those arteries, and it decreases the arteries' capacity to swell or increase to accommodate the blood flow every time your heart contracts. Another cause could be hardening of the arteries. So for example, a long history of high salt intake, for example, in your diet. Other things like smoking also can contribute to heart condition or heart disease or coronary artery disease. There can be a genetic or hereditary factor as well. So if you have a history in your family of people that have heart disease, there is a genetic component as well. So you need to be really mindful of those lifestyle factors. However, first aid is not necessarily about dealing with those issues, because that's really up to the person who owns that particular heart. When it comes to first aid, we need to look at the symptoms, the signs, and the treatment. Okay, so the most common symptoms of heart attack that you will get, and you may not get all of them, but you may get a combination of them, is tightness in the chest, like a spasm of the chest area, tingling and numbness down the side of the body, which can start in the shoulder, the neck, the jaw, can go down the arm. Okay, profuse sweating, clammy skin, can be a shallow, rapid pulse. You can feel a little bit disoriented. So there's a few of those things that can happen with the onset of a heart attack, and you kind of get a little bit of a pre-warning, but you kind of feel those symptoms come on. It's not as opposed to cardiac arrest, where you just suddenly stop breathing, where your heart suddenly stops and you collapse. Okay, very important, however, if you suspect heart attack, or if you suspect someone is having a heart attack, you need to call 000 immediately, straight away. Okay, don't spend a long time with the casualty and then later on call 000. If you've got someone else with you, of course, get them to call so that you can attend the casualty straight away. But it's very important that you need to get the paramedics or the ambulance there as quickly as possible. Okay, what will happen when you call 000 is obviously they will coach you through it as well. Okay, obviously as a first aider, you know, we're talking about what to do, but in the heat of the moment, there can be a little bit of panic, a little bit of anxiety, and perhaps, or definitely if it's a member of your own family, so you know, you may be a first aider, but this could happen at home. It could be happening, you know, with an older parent or at a family function or whatever the case may be. Okay, so we need to consider that when we get to that situation, you know, we can be in a little bit of distress ourselves. All right, so the operator on the phone will often instruct you to get some aspirin, or if you have some aspirin. You don't administer it to the casualty until they tell you, okay? But they may get you to chew it, or not get you, but obviously get the casualty to chew it. Or if it's a dissolving type, you know, put it under your tongue or their tongue, whatever the case may be. But it's important in that case to follow instructions. All right, with the casualty themselves, however, okay, we need to make them comfortable. So we're going to show you what to do in terms of making the casualty comfortable here while we're effectively waiting for the ambulance to arrive. Okay, so let's assume I'm the casualty. This is effectively where you want the casualty to be. I want them sitting either leaning against a wall or leaning against a couch. Make them comfortable, okay, be with them, reassure them, okay. But what we want to, as a first aider, because at this point we're effectively waiting for the ambulance to arrive, and there's not a whole lot we can do other than, like I said, administer the aspirin when instructed, What we do need to look out for though is at any point in time, the person can become unconscious and they can stop breathing. So not every heart attack requires CPR. The only time you need to perform CPR is when the person becomes unconscious and stops breathing. So obviously I won't be in this position when that happens. I might become unconscious. I need to put the person onto their back as we do for CPR, and then I go through my doctor's A, B, C, D as I would for any other CPR situation. Keep in mind, however, if you have a defibrillator handy, okay, use that defibrillator as well, because the best chance for any casualty in a situation where breathing has stopped and they're unconscious is using a defibrillator in conjunction with CPR. So like I said, ambulance might get there, the person may still be conscious, and then obviously they will take the person away for hospitalisation. Some people live many years after a heart attack. Some people have a series of heart attacks. Obviously they address the cause. If it's a case of coronary blockage, they may put stents in the heart and so on. But again, that's beyond the purview of the first aider. Okay, what we're doing is simply managing the condition as it presents. Make the person comfortable, administer oxygen, administer aspirin if instructed to, and observe the person that if they become unconscious and stop breathing, then I need to be in a position to start CPR and defibrillation if you have a defibrillator possible. Okay, thank you.